physician doesn't have to spend all that time actually doing the education. So you can kind of download that activity. There's a couple of models in Canada that...
But still, here the patients wants the doctor. Here the patient, most of the patient wants the doctor to explain all of the things.
Yes.
Even if the non-medical people, whoever it may be, even if he explains better, but still they believe some words from the doctor.
Yes.
Yeah.
So that's the main thing here. They are believing here doctors are gods.
I know.
We are extension of God's hands, like that.
I mean, it's true, right? I mean, I think that what you're trying to do is to take 15 or 20 minutes, which is a phenomenal amount of time, and to get all the education done, showing them the tests so that there's validity, I guess, in what you're trying to tell them. And what we have found with our educators is that they can do different things to what we do. And at the end of the day, you're absolutely right. Even in Canada, they still want to hear it from me, but they can also hear it differently from another person, and then they've heard it twice. And sometimes then I think that might work better. But other than that, I'm interested by the stigma for using the inhalers.
Yes,
what
yes.
do you think that comes from?
So right from their childhood, it's a external that they are living in a village setup or rural setup.
Yeah.
Most of the people, even in city, who are educated also, they are thinking that once you start using, you have to use it for lifelong. Still, they are thinking asthma is an untouchable thing, like that.
Oh, okay.
So asthma means is endangers life, like that. So life it will carry, if it will affect the marital life or childbirth, like that they are thinking. So even if it's a girl child, it's worse. They will be start asking so much of questions. Will it be carrying? Will she be carrying it through her older age also? Will it be a problem? Even one person, one history I can tell. One person got married. One newly couple, not 2 years old. After marriage, they came here. They still not having child. But he told that they came. She will keep on coming. Every 3 months she will be coming for rotacaps.
Yeah.
She's better with the rotacaps. If she is not having the rotacaps, sometimes she will be having some allergy, and then she will be having wheeze. So with the help of rotacaps, she says she is okay with the rotacaps. So sometimes her husband noted that she is using rotacaps. So once he noted, the problem started. So how can you use rotacaps? You before marriage, why don't you tell that you are having asthma? So I have to spend so much of money for you. Every month you have to buy medicine for that. So keep on having the complaints. When it will be cured? So everybody will be asking about whether it's curable or not. I will be saying like it's like fever, like mosquito bite, like that. Whenever mosquito bites, some swelling will be arising. So whenever some infections, fever will be arising. Like that, asthma, don't look it as a disease. It's like an allergic manifestation.
Yeah, it's about changing the words with which they're hearing. That's right.
So it is like allergic manifestation. Don't think it as a disease, like that. I'll be telling. So like mosquito bites, some swelling will be arising, and after some few times, like that. Like so if allergic symptoms goes allergic, if you inhale some allergens, definitely will cause some inflammation and bronchospasm. Some secretion will be obstructing, so the patient will be having wheeze. So I will be trying to explain that how the wheeze happens, what is the cause for wheeze, how you have to recover from the wheeze, how to avoid some wheezes, like that I will be having, and then I will educate the patient, and then the couple I then solve that tussle with them somewhat. So like that, somehow I managed with them, and then they went happily.
Are the medications that you need, are they readily available?
Yes, sir, readily available here. No issues.
And then if the family doesn't have a lot of money, is there assistance for them to get the medicine?
So we will prescribe medicine according to the values. Yeah. If the patient could not able to buy costlier medicine, for example, you know that indicator with glycopyrronium is cost around 2,500.
Okay.
Inhaler from Rotacap, that for 1 month.
Yeah.
But for a Seraflo or Foracort, it just 270, like 190 rupees.
Yeah.
Inhaler for 2 months. So for 1 month means 380 or 400 rupees. That's it. But the patient able to contain with that Foracort, we can able to give. But if some people will be forcing me to give, for rich people will be coming, we want to have a better medicine. already having using Foracort as Seroflow, but I am not satisfied with that. You want to give some better medication, means automatically our choice will be okay, then you can go with it. But most of the time I will try to convince, even with this medication, with the proper techniques, we will be able to use. So there are no need for any higher medication. If it is able to, if you are able to know how to prevent the allergic manifestations and know how to have the food properly and and then how to take the drug with proper techniques. That's it. That will do the thing. So most of the time I will go with the basic medication itself with proper techniques.
Yeah.
So that will do.
Well, we had to teach her proper techniques this week, so we understand.
She had a cough.
Yeah.
And also we will be having some cough ethics, how to have a kerchief on the mouth before coughing, and then like that. So even a PTB patients will be having tuberculosis. So it's very, very common here. I am working in a government setup also. So we will be encountering some 6 to 7 patients per day. I think for 4 to 5 patients will be diagnosed.
Wow.
Sputum positive.
4 or 5 a day?
Yeah.
Sorry, what?
TB.
So 4 to 5.
Wow. So
4 to 5 patients, even 4 to 5 extrapulmonary sputum positive defaulters.
Yeah. Are those patients HIV positive, negative?
Yeah.
Both, I guess.
Yeah, both. So we'll be having some. Initially we'll be in government set nowadays for the past 2-3 years. Yeah, we are having the CPNAT techniques. So with the help of CPNAT, even a single bacillus we will be able to find out. So HIV patients with even 1 day or 2 days cough will be having that test. And then here now the Indian setup is slowly growing up, and then we are diagnosing the TB at the earliest. Mainly we are having the experience of having the TB patients. So my director will tell in my PG days, I can smell TB like that.
Yeah. Well, once you've seen
So how much of experience you be having? I can smell TB like that. He will tell. So after the experience for the past 8 years, I'm running the show in a government hospital.
Yeah.
So I can able to diagnose at least 60 to 68% by seeing the patient. So what is his complaint? After saying the complaints, mostly I can able to do. So because of my teacher.
Yeah.
Because of my experience. So at least for 60%. Not like, at least with the symptoms, having even temperature, sputum, and then loss of appetite, loss of weight, everything. So at least we can able to diagnose. So I should thank my teacher.
Absolutely, absolutely. Yeah, TB in Canada is in the First Nations, the indigenous people, or people who are HIV positive. So I mean, it's that's the big part of it, and those two groups.
But it's quite isolated.
Well, in those two groups, exactly.
Yeah,
so, but there's a lot of places where we go where TB is still a general infectious disease in the general population. But 4 or 5 a day, that's a lot.
We have to put a lot of effort in that educating the person who are having TB.
So much.
So DOTS here in India, directly observed treatment supervisor.
Yeah, someone comes by and gives them their pills, take them.
Yeah. So the treatment supervisor will visit them in the home itself, and they have to take the medicine before them, and then after having the confirm, then only the supervisor will move out.
Yeah.
Nowadays, for HIV TB, they are given a fixed dose combination. They have to call. They have to give a missed call. There will be number will be displayed after opening the pouch. For each and every tablet, they have to give a call.
Yeah.
So they confirm that they will confirm that they are having the they consume the medicine like that.
Interesting. So they'll call after every dose.
Well, there's a little code. In Canada, there's a little code. When you open it, you take the pills, and there's a code in the bottom. You call that in and tell them what that number is.
Yeah, exactly the same thing.
Then they know that you've taken it.
Yeah.
Does everyone have cell phones?
So now it's been.
I was going to say text, right? That's
Well,
what they're experimenting with.
Yeah.
So now it's been they are doing the thing for HIV TB co-infection.
Oh, that's.
So they don't have sanitariums anymore? Right?
No, they don't. I mean, the DOT, or directly observed therapy, works. It's a good public health measure. It's a very good public
So previously before 1 year it's only intermittent regimen.
Yeah.
According to RNTCP in India. But now for the past 1 year they have been converted into daily regimen. Now we are giving daily treatment for TB patients.
Yeah. For 6 or 12 months.
Yeah. Depend new case means 6 months.
Okay.
If default remains, we'll be having extension in the 8 months.
Yeah.
MDR TB, multi-drug resistant means 2 years like that.
Their MDR is bad here.
Yeah.
Do you end up testing the family members?
Yeah, there will be very much apprehensive. There will be defaulter cases will be coming. The family members will be very much worried. So that we will be keep on telling, but those people, he's not at all taking. He's having some alcohol habits. He goes for work. After 2-3 months, the status of well-being will be happening inside the patients. So he will be thinking that though he got cured. So he will leave all the medicines. He won't attend the calls from the supervisor or something. He will run away. So after a few months, again he will be coming with fever, cough, everything. Again he will be going sick. So he will be diagnosed as defaulter, and he will be diagnosed as cat. He will be giving cat 2. Sometimes if it is a diabetic or something, or HIV patient, he will be converting into MDR or XDR TB. So much of it. So even still, we want to strengthen the grassroots level workers.
Yeah.
So whatever in my view, whatever the newer drugs or newer protocol, we will keep on putting. But only thing, the grassroots workers has to go and give the medications, and then they should make sure the patient, whether the patient is having the thing. And main thing is here, some part of the persons be having food is the main problem, protein diet.
Yeah.
One patient in GH I met, she is very poor. She is surviving with only one handicap sister. So she is 30 years old female with only 16 kg weight. See how much of emaciated. So she could not able to take food. Somehow we have gave some protein powder and TB drugs, and here they are providing drugs. She want to meet her sister in the home. So somehow their neighbors they went took her to home. So I asked how they are having the food. What's the source of money for them? What's the source of food? They are telling that the government, Tamil Nadu government is giving 35 kgs of rice through ration, through society, free.
Yeah.
And then for handicap, they are giving 1,000 rupees per month. That's the only source of money for them. Only 35 kgs of rice, and then only 1,000 rupees money for the entire family. That is 2 members. So with them, with the money and that rice, they are surviving. So nobody to support the family.
No.
Right.
So on the day of discharge, one person came. That is on one religious leader. See that what are the medications we have to give, what are the food we have to give. Just we give some tips, sir. We will start giving. We the members in the other members in the village will be helping them, like that they are telling. And then we suggested something, and then they took her to home. There is no follow up for past 1 month. I am waiting whether she will be coming, whether she will be reporting. I am eagerly waiting. I don't know what happened to her.
Oh,
Yeah, she's so protein malnourished.
right.
Her ability to recover is very limited. Yeah.
I am hoping she will be coming one day and reporting me.
Yeah. That'd be very good. That'd be a very good story.
Yeah.
Yeah. Well, that is still the stories. One last question about the asthma and COPD. Do you use the biologics very much? Like the monoclonal antibody therapies. Do you use those very much?
So I'm not having much experience about monoclonal antibodies here. So
Well, it's a very small piece of the pie. It's a very expensive piece of the pie, but a very small.
but
piece.
whether patient will be affordable or not, we have to think it.
Yeah.
So if some persons affordable means definitely we could
Yeah.
start taking.
Yeah.
So frankly speaking, I'm not experienced. I'm not having that experience. While
Oh,
giving
you're trying to get people just to take their medicines regularly. I mean, that's the
Yeah,
point that
it's
you're
like-
So they will, the companies will keep on approaching, but whether the patient will afford for that,
No.
so still I'm having doubt. But for the past 8 months or 1 year, I've been here.
Yeah.
So I have to explain. I have to ask the patient. If somebody the patients are not containing with the medication what I'm giving, so then automatically I have to switch over to that antibodies.
Yeah, exactly.
So then definitely so automatically the patient, I have to convince the patient, and then I have to start the treatment.
Yeah.
And biologics are complicated in the sense that they have to be administered
Yeah, injection
by
sites.
injection and injection sites. But I can imagine just even compliance with their regular asthma medication, especially with the stigma that you talked about, is probably the biggest challenge.
Yeah,
Is
definitely.
getting it out to the community, having them take their medicine in the community, and making sure that they have a support network to support them to take the medicine. Yeah.
And also the doctors who are prescribing should teach the technique properly.
Yeah.
Yeah.
So most of them who are maybe writing the inhalers or some will be asking how you, I will ask how you are using the inhalers. Somebody will be liking spray like that.
Yeah.
Yeah.
So it will be interesting.
Do you use a lot of aero chambers?
Yeah.
Yeah.
We having sprays or whatever.
But still.
So I want to know how the patient is using, how the physician taught them.
Yeah.
So I want to first clarify. Then I have to teach my technique. What's the universal technique?
Yeah.
So then they will be happy. So nobody taught me like that. They told that take the medications. It will be having the in the stores, and somebody will be having the stores. We have to in every visit. We have to check it out with the patient
Review it. Yeah.
whether they are using the technique properly. Because they will be complaining. I am not having the cough or breathless reduced. Still I am having cough, so I want to check it out whether they are having the technique properly. Even so, I will ask that OP girl or somebody staff nurse to educate if I am not having time. But still, when they come for a second time, when they come, I want to check it out with whether they are using it properly or not. It's the doctor's duty.
Now, is there any kind of material that you can give them, or do they have access to downloading a YouTube video?
So,
That kind of stuff?
we are having some apps are there.
Yeah.
But still, even after the thing, only few members, only few people who are educated, that too who are using the, now only for the past 2 years after the thing, they are using the net system. Past 1 or 2 years, still now from the rural or village setup they are not able to use. Just they will call and switch off. That's it. They don't know how to use the apps and all.
Wow. Okay.
Yeah, because that's one of the things that we're.
So definitely that asthma educator role will be a bigger thing here if we appoint them.
It would be very big. In fact, like my asthma educator, she just has people scheduled just to see her. And it's to address a lot of these issues that you're bringing up, and then when they come and see me, I just reinforce it, and I can show them numbers, and then they can believe that their lung function's better. Because the thing that always amazes me is that if they've been short of breath for 30 years, that's their normal. And they don't know how good they could feel. They don't know where the cough is coming from, because that's always how they've been. So it takes a bit of convincing to tell them that there's something wrong, right? That's the problem. And then if you add the stigma in, well, they don't want to be wrong.
I'm not an asthmatic.
Yeah, exactly, right.
So even sometime I will tell, it's like asthma like disease, not exactly asthma, it's asthma like, oh, then okay sir. Like that.
It's okay.
It's like asthma, not exactly asthma.
Yeah.
Then it will be convincing. Okay, I'm not having asthma. Okay sir, thank you sir, they will be saying.
See, we're salesmen sometimes, right?
Pardon?
We're salesmen sometimes. We're not always a doctor. We got to sell the thing to our patient, right?
Because they will complaining, sir, that doctor told that I am asthma, you have to take the medications for entire life. So I'm very much scared. I very much keep on trying for the past. They told that my child is having asthma. The child has to take that inhalers for the entire period of life. So I'm very much worried about the thing. What's the thing happening, sir? Very much apprehensive, panic. So what's the thing? So it's not that. For once the age carries on, sometimes change of environment will change the thing, change the fate. So at that time you won't be having the symptoms or like that. They have to convince everything. So some 50 to 60% will be carrying the disease. So sometimes they will be they'll be cured, something like that. I have to convince them.
Yeah.
So like that, stints so much of the patients will keep on coming. Like that, child pediatric asthma is definitely a worry. It's a challenge for me.
Yes. What do you think the incidence of asthma is in the rural areas in India? Like in Canada, it's 6%. Right, I'm just curious as to like 6%.
So only seasonal, mostly.
Seasonal, okay.
Oh, okay.
Seasonal. The winter season, even for the only his age will be around 28, 29.
Yeah.
For the first time, will be having the thing.
Okay.
They will be having the thing, but with the help of some counter medications like steroids, 1 or 2 days medication, they'll be clear the symptoms and they'll keep on going.
Yeah.
So they don't know they'll be having symptoms right from from 15 or 16 years. But they will be coming only with the age of 28, 29. with the help of betnosol or something, that dexamethasone will be counter medication they'll be having. Some steroids help, they'll be